My research in traumatic brain injury, particularly children who have experienced a traumatic brain injury, is really born out of my role as a nurse. I've always been very interested in caring for trauma patients, and I've always been fascinated by the children who've experienced a brain injury, mostly because some children do really, really well and others do really poorly, and I've always been interested to understand why that was. So my research has really looked at going beyond the basic care that we provide, but really looking at how the brain responds after it's been injured. So in the ICU, in order to provide for children, we take into consideration the environment in which their illness or injury occurred, but more importantly, we look at how physiologically they respond to that injury or illness, and then how it is that we then appropriately treat them. And then how do they respond to that treatment? So for me, I've always been very fascinated in looking at what is the brain doing, and then what is it that we should be doing better. So for example, are there better treatment approaches? Might we need better diagnostics? Might we need medications that we're not using, or developing new medications? And so I've done most of my work in this environment of searching for that answer. And that's really come out of my North Star, which has been the patient and the family. It always directs me as I move forward with my research. Am I impacting the overall health of children who have experienced a traumatic brain injury? Does my work help do that? And also, does my work help then support the families who are now caring for children who are brain injured? I felt that much of the work that we do here at Duke is very novel. And I'm hoping that as we continue to move forward, we really will impact overall health care and health outcomes of children who have had and experienced a traumatic brain injury.